It's Nicola here at the DEC, the Disasters Emergency Committee, on day 6 of our East Africa Crisis Appeal. As always, it is a very, very busy day here at DEC HQ, and we have lots of visitors in the office today. I'm delighted to introduce to you this morning Hassan Dour, who is Save the Children's Country Director in Somalia. Hassan has just got off the plane last night from Nairobi and come straight into our offices this morning to talk about the situation in Somalia. Hassan, we've seen lots of distressing images on our screens here in the UK of children suffering in Somalia, South Sudan, across the East Africa region. Tell us, what we see on our screens, is that what it's like on the ground?
Well, it is slightly different. It's not like what you see here. It's a much milder image. You would see one video or picture of one child. However, when you go there and see hundreds of those children together, then it becomes much different. It's much more sad and horrifying. And the situation at the moment is quite dire. You can imagine when 6.2 million people are suffering from a crisis situation and need assistance, and you go and you look at them and you look at the situation, it's different.
So yes, Hassan, as you say, the scale is immense.
Yes.
But just this morning on the front page of the Mirror, they talk about the story of one child, Hamdi. Now, as this child was being helped by Save the Children, and we weren't able to save Hamdi's life. Now, I understand you were actually here on the Mirror's visit last week. Tell us about what happened.
So, Hamdi was admitted in one of the stabilization centers that we are running in Garowe, Puntland. And when Tom did the story, we went to the stabilization center. Along with Hamdi, there were a few other children who were admitted. Unfortunately, Hamdi could not make it, but there were two other children who could not make it because they came at a situation when they were in a very, very critical situation, and we tried our level best to save their lives, but that could not happen. But these are three children. At this point of time, we have over 200,000 children who are suffering from severely acute malnourishment. And these are the children who are literally at the verge of dying. They need assistance in a week or so, because if you don't provide a severely acute malnourished child with immediate supplementary feeding, it becomes very difficult for them to survive.
I mean, that is one of the very clear messages that's come out through our own appeal, but across the world, that we need to act now. So explain to us what Save the Children is doing now on the ground to help those 200,000 children that you talked about.
Save the Children has 14 offices across Somalia. We are working with a workforce of over 1,000 people. We are providing emergency health, we are providing nutrition services, providing water, food, cash to enable families to buy food from the market. And in the month of Feb, we reached out to 200,000 people. We are further scaling up, and our ambition is that by June, we should be reaching out to 2 million people and ensuring that they survive. As Save the Children, we are quite focused on children and making sure that children survive, because they're the most vulnerable group in this crisis.
So Hassan, talk a little bit more in detail about what the support and the treatment is that Save the Children provide to children. What will our UK donors' money pay for?
At this point of time, the support that is needed is to scale up the nutrition program. There are over 1 million children who are suffering from acute malnourishment. Around 1 million children, they are moderately acute, and 200,000 who are severely acute malnourished. So nutrition supplies, emergency health care, cholera and acute watery diarrhea is becoming a big crisis. From the beginning of the year, there are over 11,000 cases of cholera and acute watery diarrhea. 300 people, mostly children, have died because of that. It is spreading, and support is immediately needed to curtail the outbreaks of these diseases. And with passage of time, when hunger increases, what it really results in is people's inability to cope with even minor diseases. So a strong health response is something which is immediately required, and at the same time, food assistance and cash for the families so that they can survive this crisis.
So the British public have been incredibly generous in supporting this appeal so far, and we get lots of queries on our social media asking what more the British public can do. So what can they do?
Well, I mean, first I would like to mention that the British government has been very forthcoming in this crisis. They provided £100 million beginning of Feb for scaling up the response. However, at this point of time, £650 million are needed till June to ensure that we can avert a crisis, we can avert a famine. And while I was flying, I was just looking at some numbers and saw that if just top 10% of the British public donate just one day of their annual earnings, we can avert this crisis. We can save 6 billion people with just 1 day of British people's earning who are in top 10% bracket. And I know, have been in this sector for past 12 years, that British public is one of the most sensitive public towards humanitarian crisis globally. They donate, and they donate generously. And I have very strong hope and believe that they will be stepping up much more than ever before.
Well, British public, you've heard what Hassan had to say. If the top 10% earners in the UK donated just 1 day of salary to this appeal, we would be able to help the entire country of Somalia to start to stave off starvation before June. So you've heard what Hassan says, but we're very grateful. Even if you're not one of the top 10% of the UK taxpayers, every £5, £10, £25 helps. As Hassan was saying, sachet of plumpy nut, the fortified peanut paste that can help bring children back from the brink of starvation. One sachet is 25p, so £25 can provide a month's supply to bring a child back from the brink of starvation. And again, we wanted to thank the Daily Mirror for highlighting Hamdi's story. Sadly, Hamdi died, but it does reiterate and reinforce the message that we cannot delay. Please, please, please donate now, because time is running out to stave off this famine, from famine appearing, and stave off a huge catastrophe. So thank you again, and don't delay, donate.